welcome to Great Day Houston. Thank you very much. It is Medical Monday. When it comes to our health, we're living longer. That's the good news. But the bad news, we're also outgrowing our body parts. In today's show, we'll show you how doctors are using modern technology to fix worn-out knees, eyes, teeth, and legs. But first, when it comes to jobs, being a doctor can be a good living, but you have to start with the passion for helping people. Then you have to figure out what part of the human body you want to make a career out of. With school about to start, we know that thousands of students are having to make career choices. There are about 100,000 medical school students in Houston alone. Our doctors today are breaking out in a sweat just thinking about those days, long hours, yes? Studying, yes. Student loans, internships, residency, all that type of stuff. Well, let's find out why they decided to become doctors. Welcome orthopedic surgeon Dr. Stephen Brown, ophthalmologist and LASIK surgeon Dr. Colby Stewart, interventional radiologist Dr. A.J. Valenson, and periodontist Dr. Ralph Hanna. Good morning. Reasons we go into certain careers. Obviously, if we saw parents or loved ones who were in that career, other times it's an experience that we had. My mom bought me that Fisher-Price little doctor's kit. You know what I'm talking about? Yeah? And she actually put some real things in there like methylate and stuff. And I was healing kids all over the neighborhood. And I thought I was going to be a pediatric neurosurgeon. That didn't happen, obviously. But anyway, when I ask you all why it is that you chose to become doctors and then what area of medicine you decided to practice. Dr. Brown, as an orthopedic surgeon, it was a kind of a lifetime experience for you.
It was. And, well, good morning. I grew up in a very medically related family. I had a sister with a disability, and my father was a physician, so I was exposed to medicine at an early age, and I loved it. And then myself had an injury. I loved to ski. And in high school, I had a few skiing injuries and blew out my knee, blew out my ACL. And that's when I had my own first personal exposure to it.
Yes, and then you decided to go to medical school. There's the picture right there. Look at that. Okay, there you go, right there.
Oh, those are the long hours you're talking about. Yes. I was an intern back then.
Yeah, I think a lot of people we don't know. We see you, when you decide to go to medical school and at the end part, but we don't know what it takes to get there. You better have your mind made up you want to do this, shouldn't you?
That's right. It's a long journey, but a worthwhile journey. Yeah. It's been quite the trek, but I'm glad to be here today.
All right. Dr. Stewart, yes. For you, it's all the family.
That's right. My father was one of the original starters of Houston Eye Associates. When they were starting, there were 4 of them, and now there's 50. But when I was growing up in high school, I would go work in the summer with my dad, be a scribe, and got exposure to patients, and he'd let me look through the microscope, and just years of being around eye surgery and eye care, I fell in love with it, and so that's why I wanted to continue on doing it.
I was going to ask you, sometimes we want to follow in our parents' footsteps because we want them to be proud of us, and it's something that we know. Did you ever consider any other part of the body? Like, did you ever think, hey, why not nose? Why not break out and go do the nose, right?
I did, and I was fascinated with medicine in pretty much all fields, but since I was so close to ophthalmology and I already kind of felt like I had a head start, that's what I wanted to go into.
Yeah. And it's one of those areas, too, where I remember a friend of mine who's a doctor who said, he goes, the reason why he did ENT, he goes, because nobody dies, right? He's like, it's a little bit easier to deal with there. All right, Dr. Valenson.
Good morning, Deborah.
Good morning. Okay, you decided to. Okay. So what brought you into medicine? And sometimes too, if you're a smart kid in school, and usually when you're smart, people usually go, okay, so obviously that's medicine. Obviously you're going to be a lawyer or a doctor. But what brought you into medicine?
Very similar story to these gentlemen right here. My father was an orthopedic surgeon, like Dr. Brown. And when I was a little kid, I used to follow him around to Central America and watch the good deeds that he did. And it was very inspiring, and he helped a lot of people, so that kind of set me on the path towards medicine.
Yeah, and there's a picture right there. There you are. That was a happy day, wasn't it?
Yeah. I was very happy to get out of medical school that day, but that's because I didn't know what was in store for me during residency, though.
Yeah, right. And explain to people who don't know what residency is, because, you think you graduate from school, I've got my paper, let me go start practicing right now. There's a little stuff in between.
Well, medical school is like getting your college degree, and then residency is where you specialize in your actual individual field. And that's usually where the longer hours come along and you're treated more like a grown-up doctor. So that's when the real hours started kicking in.
Why'd you decide radiology?
So interventional radiology is where we're able to do procedures but without doing surgeries, and it just seemed like a very innovative field. So rather than, through little tiny incisions rather than cutting people open, things like that.
Yeah.
And it just seemed like really ahead of the curve, and it was a field that's changing a lot. So
Yeah.
I found it to be very fascinating.
Because, you know, I had a friend who became a doctor, and she didn't find out until deep into medical school that she probably shouldn't be a surgeon because she did not like the sight of blood, fainted. And I'm like, at what point did you decide that maybe? She's like, yeah, so I decided to do something else. All right, Dr. Hannah, what about you?
Well, my story is maybe a little different. I don't have anybody in my family that is doctor or
Good,
dentist.
there's hope for my
so-
son. But
Yeah.
because I'm sitting there thinking, okay, my son doesn't stand a chance.
Actually, all what drove me into it, it was gradual, I think, step-by-step process. First, I started by liking, I always liked biology, how cells interacted with each other, healing, wound healing, all those things, and then helping people out, getting them out of pain, getting them out of their lifestyles, changing lifestyles. Then my other passion was working with my hands, building erector sets, Legos, all that growing up was like my fascination.
Yeah.
And I found dentistry that combined both. It combined the science, combined the art, combined, there's a lot of artistic into it. There is a lot of satisfaction showing the before and after, showing.
Speaking of before and after, let's take a look at before and after of your picture when you're, okay, oh, you look the same. You have not changed a bit. What is going on here?
Not much. No.
Yeah, there you go. Look at the same. There you go, right there. You know, but one of the things you talk about getting people out of pain, which is something that all of you can do for people. But the other thing is just giving them that sense of self-esteem. You do that by restoring somebody's mouth and teeth. And it's got to be great to be able to sit there, look at a patient, and solve their problem. That's got to be the biggest payoff, huh?
Yeah.
Absolutely. I'll tell you, one of the biggest joys is when you treat a patient and they come back in a few weeks, a few months later, and they're just a changed person and they're loving it.
Yeah, because with you help people literally get up and start walking around. You literally can help people see.
Right. And that's something that they can see right away. 'Cause you come in, you can't see, and then you leave and you can see. That makes a really big difference.
Yeah, same with you in terms of people have issues with their legs. And, you know, in the old days we did vein stripping. Today it's a very simple procedure.
Yeah, and that's what makes it all worth it. Everybody has parts of their job they don't like, but when you make an impact in somebody's life, that's really what makes it all worth it.
Yeah, and then you can help people see a smile and restore that confidence.
We have that. Well, when I started back like 15 years ago or so, it was we didn't have the advances we have today. Today we're able to give you a same-day transformation.
Yeah.
And before it was 6 to 12 months, 18 months in some cases, before you actually see the final result. Now we have instant gratification, which has really made a big change.
And which is what we're going to talk about in each one of your areas of study is how today's technology get people up and moving in a much faster way and less trauma to the body, the whole bit. All right, so thank you very much. Get ready for your segments. But today on Facebook, as kids, many of us would say, when I grow up, I want to be. Finish that statement, then tell us, did you actually do that job? I took Latin for 8 years because I really thought I was going to be a pediatric neurosurgeon. I was preparing, but obviously that didn't happen. We'll share some of your comments a little bit later on in the show. Well, from arthritis to wrong move, there's all kinds of ways that we can injure our knees. But you won't believe what happened to our next guest. She'll tell her story, and you'll hear from the doctor that put the pep back into her step when we come back.